Time now for Restoring the Soul of Healthcare from the Healthcare Clinic in Austin.
It is that time. Once a month, we get together and visit with our friends from the Healthcare Clinic. And today, joining us in person, Aase stops by the studio, and you've got a lot of really good, interesting, fun news to talk about.
Yeah, it's great to be with you in person, John, because I wanted to talk about, because I was out here a week ago to record our 30-second spot that we do on the AM station. Mm-hmm. And as I was recording it, I said, we were at 872 members overall at that point. And so I said, nearly 900 of your neighbors have already joined. And I was rounding up a little. I wasn't fudging a little bit because we're usually adding about 1 or 2 a day, maybe, 6 or 7 a week. And but that was also happened to be the day that we were concluding our founding member stage in Rochester. And we had an open house that night from 4 to 8 in our clinic over in Rochester. And by the end of the day, it was no longer embellishment, it was understatement. Wow. We actually got 35 new members on one day alone, which is the biggest day ever joining, just as we were wrapping up those special savings that we had as we started there. So we're now up to 920 members altogether. Wow. And 202 of those are in Rochester. So we're just feeling very blessed. Sometimes you say, be careful what you pray for, because now we're working hard to create the space for those folks and doing some things to create more appointment slots and doing more blood draws and everything. But it's been, it's a good problem to have. And so we're trying to trade one set of problems for a better set of problems.
Well, and it tells you what you really believe from the get-go, that this was the right thing, you and Dr. David Stribble, that this is a better way to do it, and you understood it, but it's getting that message out and getting other people to kind of take that initial leap of faith, but then to really see as it plays out that this is reality. We can really make that difference.
Yeah, and that's why we rewarded the founding members when they started, that they got some discounted rates, both here and then also in Rochester, because they had to be the believers up front, to help make it happen. So as a result of that, we've got a couple things happening. First, we've added some additional space in Rochester, but we also added 3 new rooms in the upstairs at the Austin Clinic, which enable us to move some of the offices up there, and it's going to enable us to put in a 3rd exam room. We also have a new part-time practitioner, a nurse practitioner. Her name is Amy Nagy. She did the last of her training with us for about the last 3 months of her. She had been a nurse anesthetist, and then she went back to become a nurse practitioner. And so we got 2 or 3 months to work with her and find out she's wonderful. She'd be great. And if we'd have the need for her, it'd be great if we could have her working with us. And so she's going to be starting with us at least part-time. But yeah, we're just, it's been neat to see how that has come to fruition.
Maybe for people that have been listening to this and hearing about the healthcare clinic, we can just back up a little bit, because you're adding a nurse practitioner. How big is the staff now? I mean, it's not huge, right? But comparatively speaking, you've grown quite a bit.
Well, we have. So we started with just Dr. Dave Strobel, a day and a half a week. So 2 years ago right now was, and then he got up to 2.5 days and then 3.5 days. And, he sort of gradually grew. Then we added a nurse practitioner, Stephanie Kimmis, in May of 2022. And so she was a couple days a week. Then we added Elizabeth Headland, who's a physician assistant. She's from up near Owatonna, and she's 2 or 2.5 days a week now as well. Stephanie's from Orinoco, and so she was part of the reason why. Actually, she was entirely the reason why we wanted to start in Rochester, is so she could practice closer to home too. Sure. And so she's going to be moving closer to full time. By, as we're adding more people over in Rochester. She's still going to always be in Austin at least 1 day a week, but we're growing there as well. And now Amy joining, she lives near Casson, I think, so she could kind of go either way, and will be probably in both places, eventually. We also had a lot of interest from other practitioners who've said, wow, I'd like to do something like that. So as we grow and as we have more need, hopefully we'll be able to get some of them in too.
Yeah, and I always ask you this, in your wildest dreams, did you anticipate? Obviously you would have, because otherwise there's no vision there.
Yeah.
But at the pace that it's gone, I think probably exceeded what you may have anticipated initially.
Yeah, it has. So so it was slower at first, and now it's faster. And I think one of the other things that's kind of neat is we're looking at as we're coming to the second anniversary of when our founding members joined in Austin. We're looking at, so how can we develop options that, just maybe different membership options that for people who haven't said, well, yeah, I need the whole slate of services that you provide in your comprehensive membership, but maybe there's some level that we could make work. So we're working on some of those. And when we talk next month, I'll be ready to tell you more about them. We'll have those finalized. And so that's the tease. So stay tuned for a whole month.
We have 4.5 minutes here. We can get into it. No, we'll foreshadow what we're going to talk about next month.
Exactly. Yep.
But it is interesting, and maybe somebody's listening here and they've never heard us talking about the healthcare clinic. Maybe you can give a quick overview of just why you believe and why you have demonstrated this is such a good approach to healthcare.
Yeah, well, a big part of healthcare is a lot more expensive than it needs to be because of the insurance involvement, and so the way we really keep the costs down is by people pay cash. I mean, they pay for a membership, for a monthly membership that just covers a pretty comprehensive suite of services, lab tests, some prescription medications, the office visits with the practitioners, the acute care, the quick care kind of stuff for our members. And that's all wrapped into one, membership rate. And so that gives us, that's a much better, more affordable, way to get most of that care. So a lot of people have insurance. I mean, most people have insurance and should have insurance, and that's to cover the catastrophic things. Yeah. But then they've got a big deductible, and so for a lot of them, they never go to the doctor because it's all going to be out of pocket anyway. And so what we're offering them is a way to say, okay, for this amount of money, you can not have to worry about that. You can just go to the doctor when you're sick. You can get the care that you need and not have to worry about what the bill is going to be.
Or even you just have a concern. Something's happening and I think a lot of people internally, when something's not right, but you resist going to the doctor because you're going to either out of pocket with your deductible or hopefully you meet your deductible, then you go in more often.
So there definitely are some of those of the people who know something's wrong that's kind of nagging at them, and this lets them get that. But the other part is people who don't have any clue. And they say, I never go to the doctor, okay? But what they need is some diagnostic blood tests that might show something early that they could actually do something about instead of waiting for it to get worse and worse and worse. And that's actually part of the big value that we have too, is that because you don't pay for those lab tests, they're just included in your membership, then you can find that stuff out and then see whether, make a game plan for what you want to do next.
That's kind of where I was headed, that the irony here is that a lot of times, even though you have insurance, you wait until it's catastrophic before you go, and you could have avoided that entirely, or hopefully mostly, by doing preventative maintenance, if you will, and just knowing ahead of time when something happens, get on it right away.
Right, and that's part of why healthcare costs are going up so much too, is because people do wait to that point when it becomes really expensive to treat, instead of dealing with it early and actually being happier, healthier, and wealthier because they're not spending so much on all their care.
And through the years that we've had these conversations, I like that we've had guests join us that have been success stories, that when they take control of their health care and they use some of the program in modifying things that they're doing, the changes in their day-to-day well-being is such a wonderful payoff. And I think that's probably the glory of this whole thing, is that people feel vested and they're making a difference in their own lives.
Yeah, it really is. We just recently had a leadership team retreat, and we sort of boiled down what's our purpose, and we're building relationships. So we're building relationships, and we're equipping our members to take charge of their health. Okay, so that's what we're giving them, the tools. They need to be the driver. We're just the coaches, and we're guiding them along the way. Okay, our practitioners and then our health coaches, giving them the tips and the tools and the support that they need. But really, it comes down to each person taking responsibility, himself or herself, to be able to, decide where they want to go. We're not hectoring them, we're not nagging them. We're just saying, this is sort of what we recommend, and if you want to do it, we're here to help you.
Yeah, take a look, and if this is right for you, let's do the paperwork and get moving on it.
Exactly.
Let's remind people how they can get more information and get signed up and learn more.
Sure. Well, we are at 308 4th Avenue Northwest, block west of St. Augustine. Actually, it's a block east of St. Augustine's, block west of the Hormel Historic Home. So just in the heart of Austin. We're also in still in the early bird phase in Rochester. So if anybody's over near Rochester in our listening area, they can save a little bit on membership there. Or they can call us at 507-279-2345 or go to helpcare.health and learn all about it on the web.
All right. Fantastic information. Great news on the growth, and just keep going on. It's going to be
Thanks
good.
so much, John.
And we'll find out what that was.
Oh, yeah, we got
Foreshadowing
great
next month
stuff
when we
coming
get
up next
together.
month.